place, I would like to start by recognizing the presence of the Director General of Juba Teaching Hospital, Dr. Anthony Lupai. I also want to take this opportunity to recognize the entire team of Tamil Pharmaceutical, led by the representative, Dr. Altum. I also want to take this opportunity to recognize the presence of all our senior consultants, physicians, and other consultants represented in the room. I recognize the entire health team at Juba Teaching Hospital, the medical doctors, the nurses who are represented in the room, and other health workers represented in the room. I also want to recognize the patients representing the community in the room for attending this great event with us. All protocols, if I haven't mentioned, are observed. Indeed, like what Dr. Pasquale said, today is really a great day for all of us. For me, I'm really so happy because one of my greatest concern has always been the fact that you go to most of our health facilities, you don't even get blood pressure machine, very simple, you know, for vital sign measurements. So most of our facilities lack the basic tools to do a proper medical care. South Sudan is among, or South Sudan, like any other countries in the world, is facing the challenge of the growing public health concern of non-communicable diseases like hypertension and diabetes. So hypertension and diabetes is not only in the developed countries, but it's also becoming a growing public health disease of concern in South Sudan. We had some of the epidemiologists mentioned by our intern doctor who presented, and based on the data she presented, it shows that the prevalence of diabetes in South Sudan, based on previous studies conducted 5 or 6 years ago, shows that we have a prevalence of about 6.3 for diabetes. For hypertension, very old studies have also shown that we have a prevalence of about 9.5. So these are really old data. It sounds low, but again, it shouldn't motivate us to stay silent and say that South Sudan is a low prevalence country for diabetes and hypertension. Yes, among the African region, our data still shows that we are among the low prevalence country, but again, we should be very, very vigilant. Diabetes and hypertension in South Sudan, they are non-communicable diseases, but again, almost reaching a level of neglected diseases because we are not giving them the attention they deserve. We know South Sudan is a country which has high prevalence of all the tropical diseases, so most of our focus goes on management of tropical diseases and we forget the non-communicable diseases like diabetes and hypertension. So we need to balance our efforts to also address non-communicable diseases like diabetes and hypertension because the effect can be very, very great. They can cause high mortality rates, especially in elderly. So with this program of today, where we are going to launch a medical camp for diabetes and hypertension, and also I see we have other devices like the lipid test device, which is among the other devices we are going to have, this is a great opportunity. I think I talked already to Lawrence. I said we need to have a big advocacy to bring as many as possible patients, not only patients, but the community to come out and get tested. Because one of the challenges is the fact that people don't come out to get tested unless they are sick. It's only when they are sick. And most of our diabetic and hypertensive patients are diagnosed when they already have complications. So we really want to minimize to get to that level of diagnosing people at the time when they have complications. So it's very important that we focus more on prevention, because prevention of these diseases is not up to the level we expect to be having. We really need to put more efforts on health education. So health education should not only be during gatherings like this, but it should be a day-to-day activity at the health facilities. When the patients are seated, we should talk a lot about these diseases, how they can prevent them, and also encourage patients who have hypertension or diabetes to come for regular follow-up, because that is the only way we can prevent them from getting complications. Of course, we have a lot of challenges. If I have to list them, we have a long list of challenges on how, on why we are not able to address all these issues. One is the fact that I don't know if we have clinics, but I only know in Melekia Primary Health Care Center, they used to have a diabetic clinic. That is the only place I heard of having a diabetic clinic. We need to have similar clinics across the country where people can easily access services, including Juba Teaching Hospital, because most of our referral medical cases come to Juba Teaching Hospital. Why can't we have at least one day dedicated just for testing patients, just for diabetic and hypertensive patients? I think, Dr. Anthony, this is something doable. We can dedicate 1 free day and provide these services free of charge to our community so that people can come out easily. Most of the people don't come to the hospitals, not because they don't want to come, but because they cannot afford. So let us provide the basic tests free of charge. Especially with these equipments on board, I really urge all the facilities represented here, whoever receives this equipment at your facility, please make sure patients access the testing services free of charge. Let us not charge them for getting these tests. This is my message. This is a strong message for all of you. I also want to emphasize on the issue of health education. As we do I think it is 3 days campaign, yeah? So as we do the 3 days campaign, let us put more emphasis also on educating our patients. So let us educate both those who have the disease and those who don't have the disease, because it's important to prevent them. Let us give prevention and both prevention and also messages for those who are already affected by the disease. I know the treatment is also another challenge, because of course we are going to do testing, and I always say it's not ethical to test and let the patient go. So we will also look into the aspect of treatment. I don't know whether we have medication. I have not yet sat with the team to look into the program. What happens if you get diabetic patients or hypertensive patients? Are we going to treat them? So I would like to sit with Dr. Anthony and see if we can avail some free medication. We have representatives of the pharmaceuticals in this room. I believe if the medications are not available, you can also do something to support so that we're able to have some basic medical treatment, some basic medicine, to give or to offer those who are already affected by either diabetes or hypertension. So I don't want to talk much, but mine is really to give a lot of thanks to Tamil Pharmaceuticals for coming up with this campaign, and also to all the team that has joined Tamil Pharmaceuticals in providing us with these equipment, including the Sinocare. They are not here, but you can pass our message to them, because this is a very, very important step. It's for screening and also preventing our diabetic patients from getting complications. One thing that I liked was the fact that you also advertise the fact that if you buy 2 strips, you can get the equipment free of charge. So the price was not mentioned, but I was just talking to Dr. Zoom, and he said the price of the strip is around $8. So I think it's not that expensive if you compare yourself coming every time to the hospital to get tested, and you have to pay for transport and so many other costs for you to reach here. So I want to encourage you to also encourage our patients to have these machines and be able to, these equipment, and be able to conduct the testing by themselves at home, so that they do their regular monitoring. But this doesn't mean that they don't have to come for regular follow-up with their doctors. So this is very important. Let these equipment not be for facilities alone, but also let us encourage our patients and also train them during this campaign to know how to use them and monitor their blood sugar as they are at home. With these few words, I don't want to take long, but once again, I want to thank the entire team of Juba